is just across it. Okay, and then where did we say that that ran from?
The fibular head.
Okay, it goes from the lateral upper condyle to that fibular head. Okay, so we find fibular head, lateral upper condyle, we just find in between, and then we should be able to flick right over it. Okay, and again, if you push hard enough, you'll be able to feel it, flick over it, and then she probably won't like it.
Yeah.
Okay, that's how we'll get the easiest way to get to LCL. Okay, good, slide forward, let your leg hang. So MCL is going to be just kind of the opposite side of the joint, right? So it's going from medial, or the tibia and medial epicondyle. So we can find the tibial plateau, find the condyle, and then we know it's right in between. This one's not going to be easy to palpate because it's interarticular. Okay, it's in with the capsule, so it's not going to be as easy to find. But you still should be able to find a little bit of a thickening right through here, which again probably doesn't feel great if I kind of push and flick over it. Okay, so that's going to be MCL. Okay, medial meniscus, we can kind of get on that front border of it if we find the joint space. So if we come up where, remember we found our tibial plateaus last time, we came up and you can feel it bulge out, and then it should sink in and you should hit a soft spot. Okay, that's going to be the joint line. Okay, so if we go on either side of the patellar tendon there, or patellar ligament, okay, you're going to be on the joint line. Okay. And if we go to that anterior joint line and I just internally rotate her a little bit, I can feel that medial meniscus kind of bulge out into my fingers a little bit. Okay, and that's all we're going to do to find that. Okay? Okay? That hurt too?
Yeah.
Yeah, okay. Do you have a meniscus there? No? Okay.
I think so.
Deltoid ligament, go ahead and slide back. So deltoid ligament is medial or lateral?
Medial.
Medial. Good. So it comes off our medial malleolus. It comes down the sustentaculum tali. It goes to that. Did we palpate the trochlea of the, or the tubercle of the talus? Did we do that, or we cut that out last week? We did that with you guys?
We did that.
Okay.
Yeah, we did.
I cut it out of the other section then. The trochlea, and then it comes down to the talus as well. So that deltoid ligament's kind of running in 3 different directions here. The easiest way to find it is from medial malleolus to sustentaculum tali. Go right in between those two, and then there'll be a nice thickening right there. You can kind of flick over. Even if you push on it hard enough, it'll be a little bit uncomfortable. Okay, and we want to go, when we're finding ligaments and muscle fibers, what's the best way to palpate? Perpendicular, yep. So we know it's running this way, so we just want to go right across those fibers, and we can feel a thickening right through there. Okay, and then the lateral collateral ligaments. Did you ever sprain ankle sprains? Any injuries?
Yeah. This one?
This one? Okay, cool. So I can show you the little test. Okay, so the first one is anterior talofibular ligament. So it goes from the fibula to that talus. Okay, remember that one's running pretty much pretty perpendicular with the ground. So again, they're not great to be able to palpate them. And again, if she's had multiple ankle sprains, you might not be able to get it. There's some of it right there. Okay, if someone's had really bad ankle sprains, it's going to be torn. But anybody with an acute ankle sprain and you palpate right between the fibula to the talus, it's going to be a little bit uncomfortable on them. Okay, and then calcaneofibular ligament, it's pretty much running, it runs a little bit posterior, but if we put their foot up in a neutral position, that kind of makes it run almost perpendicular, vertically. So we just come off the lateral malleolus, and then we're going to feel our calcaneofibular ligament there. And then posterior talofib, I'm not so worried about it. It's definitely not going to be on the competency exam. It runs from the posterior side of the lateral malleolus around to that talus on the other side, so it kind of wraps around. That's why you have to dislocate that ankle to almost be able to tear that one. So if you just come off that posterior side of the lateral malleolus and you dig in there, you might be able to feel it. You can flick over it right there. Again, it probably doesn't feel super good. Okay. So we talked about the mechanism of ankle sprains is plantar flexion inversion, right? So you can see as that anterior talofibular ligament sits like this, if we go into that position, you see how that would really, really stretch it, okay? So one way we can test for it, we do it in the clinic, is we put them up this way. All right, so now it's running this way. So if I want to stress a ligament, what do I have to do? How do I stress it? By shortening it or lengthening it? Lengthening it. So if a ligament's running this way, how can I lengthen it?
Wait, you push this
I
back.
could. Depends what bone you're talking about, but yes. So I could take that fibula and push it posteriorly, okay? Or I could get that talus and pull it anteriorly. Okay, so one test we do is an anterior drawer where I basically just grab calcaneus and talus and I can pull it forward. Okay, and you can see that motion happening right there, and you feel a nice little clunk as it relocates. So she's pretty loose because I can pull it. She gets a stop though, like I can feel it stop, but she's got a lot of motion there. Okay, the other way that I like to do it is I would just do the opposite of that, where I get here and I would just push it back. In that way. And then she's got a nice clunk when she comes back. So we get a nice big stretch on it, and then it clunks back into place.
I've never had it done that way before.
So that's how we check it.
Interesting. Wow.
Yep. That's how we